Hi, this video is the video before and after on a patient who have had a hair transplant done by me, Dr. John Diep. This patient had a couple procedures before, which resulted in him to have very high abnormal hairline and a lot of plugs. And this is him before, and this is him afterward. Let me tell you a story about him. Basically, the surgeon in the past put his hairline very high, and most of these are all harsh plugs. He has like 2 rows of harsh plug and 2 rows of harsh plugs on the other side. And when he walks around, even though he has some hair and he comb backward, you can still notice there's a lot of abnormal hair look and very pluggy, not very looks natural. So what we do is to get rid of the plugs and make it natural again. I have lowered his hairline because this is more like a triangle. I lower his hairline a little bit, fill in this area, thin out the plugs, and build in the transitional zone in that area. As you can see, there are a few methods to do this FUE corrective hair surgery, including the strip surgery. And before we go further, I would like you to go on my website at www.mhtaclinic.com, 1-866-999-6482 or 408-356-8600. Getting back to this patient, the harsh look of the plugs, it's very hard to fix. If you just want to put the hair in front of it, it won't work, or you cut it, it won't work at either. So as I mentioned in my other videos, there's 3 methods how to fix the FUE. I mean how to fix the plugs using the FUE method. But the first method is the strip harvesting method, where you cut out all these plugs, excise it out completely. Now that method is not very favorable. Why? One, it is too traumatic, and it will leave you a very big scar on both sides, a linear scar, and walk around with a big linear scar is not very good. And because of the trauma and by cutting and those stuff, then you feel more numbness, more chance of bleeding, more chance of infection, and all this stuff. But the end result won't be great. The another method, which has been common, was to build a transitional zone where you just put a line of hair in front of it, and hopefully to hide the plugs. However, by transplant the FUT hairs in front of it alone, when it grow, it won't grow strong enough to cover the harsh plug behind it. So you have some hair in the front of it, and it won't look right. So the best method is the FUE corrective hair surgery method. Now, what is the FUE corrective hair surgery method? Is by manually thinning out all these plugs, okay, and extract the plugs out one root at a time, or even larger punch, and to thin it out and redistribute the hair all around and not losing the plugs at all. And then after that, when we thin them out, we put the hair in the back, we will build the transitional zone in front of it also. So we gotta do it's a 2-step, but all done in one day, of course. Thin them out, redistribute in both areas, build the transitional zone a little bit. And in this case, since his hairline is so high and abnormal, and as you know in my other videos that I specialize in natural hairline, because not everybody will have a normal, not everybody have high arch hairline, and some surgeons do it's too high where it looks abnormal. So you want to do a mature hairline, yet not too high where it's not great looking. So what I did was 1 year ago, I thinned this hair plugs out and redistributed, built the transitional zone, and rebuilt the whole front. And this is what he's ended up with. Very nice natural look. Okay, very nice. Okay, and this is called the FUE corrective hair surgery. And you can see now his hair very nice and natural. There's no more plugs, and great coverage. Same thing. See, he has one row of plugs the other side, and another row, 2 row of plugs, and they look very harsh. big old triangle. This area doesn't look normal. And so after this, after did him out, hair transplant, rebuilt the whole thing. This is him on the day of surgery. Still there's plugs and all stuff. And a year later, you can see great hair growth. Very nice and natural. I still give him a mature hairline, full of hair, great coverage, great density, very natural walking around, and the patient is much happier. And this is the FUE corrective hair surgery to fix plugs, thin out plugs. And for more information, you can go on the website. Again, FUE corrective hair surgery, thin out plugs, before and after. That's what it looks like now in the front view. That's what it looks now, the left side. That's how it looks now, the right side. And to see both like this. And this on the left side, before and a year later. Excellent. Thank you.